Now let's think about negotiating treatment. This is what happened when Barry asked this patient for her views about treatment.
What do you want to do from here then?
I don't know if there's anything I can take, or I think anything I could do that would make me feel better.
Right.
If you're playing the doctor, I'd like you to have a go at negotiating treatment with this patient. You're free to use any of the strategies that we demonstrated earlier. Now let's look at what Barry actually did.
I don't think that there's something you can specifically take for your bowel. And I think we touched on the bits of the normal working day that you could start to tackle.
Like the coffee thing. Yeah.
Coffee's the easy one. Maybe what's a bit harder is the time, and having some time away from your desk and away from the telephone whilst you eat a meal, even just at lunchtime. And perhaps also that regularity of your diet in the evenings, even though you don't particularly feel like it.
Yeah.
A little bit of more relaxation time and time to do that. The other bit that I was concerned about was what I raised before about wondering whether you were actually depressed, and wondering therefore whether you should actually treat that.
Like what, to take something for that?
Yes, probably. I think there are enough things that you've said to me today to make me think that you would benefit from an antidepressant.
But I don't want to get addicted to something.
Right. Well, antidepressants aren't addictive. They're not tranquilizers. And so it works in a different way, as a way of trying to lift your mood. And I think what it would help would be your sleep and how you felt generally, possibly your appetite as well.
But then what, when I stopped taking them, what would happen?
Well, normally we use antidepressants for quite some time, mainly because it's taken you a long time to get to this point anyway. And we've talked about at least 5 years since your mum died, and probably longer. Even as you feel now, you said it's gone on for months. So we normally use antidepressants for up to 6 months or so. And because they're not addictive, you can then come off them by just stepping the dose down and then stopping them. So it wouldn't necessarily bounce back and come back again.
Just a bit worried about taking things like that.
Okay, well, that's fine. I think maybe it's something to think about. Because we've talked about quite a bit today, and I'm throwing in something else that hadn't really come up. But if we're going to do that, what I'd like to do is actually see you again in a week or so.
Okay.
How would that seem?
To see how you feel any better.
Yes, yes. And in the meantime, perhaps you could actually look at the timetabling bits and your diet, and spend a week or 10 days doing that. And let's see again how you're feeling, having done something practical about it.
Okay.
Is that all right?